Local Women Magazine presents Local Women Podcast, the show for things that matter.
Hi and welcome to Local Women's Health Podcast. My name's Emma Heaney and today I'm joined by Rachel from Concept Occupational Health. So if you're an employer or an employee, you'll want to listen to this podcast. Welcome, Rachel.
Hi, Emma.
Could you tell me about your business concept?
Yes, so our business is an occupational health business. We're based here in Northern Ireland and we provide services to Ireland and mainland UK. So our service is providing employers and employees with support relative to the health and management of that in the workplace. So we do a number of services from corporate health checks to sickness management and also health surveillance, which is the legal statutory requirement of employers who expose their employees to risks, health risks. We undertake testing in relation to that. So it's a bit varied. There's lots of different elements of it, but yeah.
Excellent. And so you just talked about the statutory requirements. You want to maybe explore that a little bit more? Just if any employees are listening, they might want to tune in now.
Yeah, so we are very, very lucky that we're governed by the Health and Safety Executive here in the Northern Ireland branch of it, and in mainland that's Health and Safety Executive. And basically they are the governing body of ensuring that people's health and safety at workplaces is regulated. So in line with the legal requirements that are set out by the likes of the Health and Safety Act, there is a requirement within employers to ensure that they're doing everything they can do to protect the health of the employee if they're put in roles or exposed to things that would be deemed hazardous to health. And yes, lots of people do take those measures. They do the likes of risk assessments, they provide PPE, but another element of it is ensuring that there is a health surveillance programme in place. And that is typically an annual programme where we would go in on site and we would test people's, depending on the exposure, we do hearing tests, we do breathing tests, we look at skin, we look at musculoskeletal system. We also do things which is called HAVs, which is hand-arm vibration. And this is for people who are exposed to working with tools that remit lots of vibrations. We do testing in relation to that. So it's quite varied. Not everybody knows of the requirement to undertake health surveillance, and we're very lucky that the Health and Safety Executive in Northern Ireland has launched a new initiative this year to ensure that employers know their requirements and are taking steps to put health surveillance programs in place for them.
And so if employers are listening to this, how do they get in touch with you to discuss this further and discuss your services?
So we are based in Banbridge. You'll find us online in www.conceptoh.co.uk. They can link it there. They can contact us via the website. We're on Facebook and Instagram and LinkedIn. But typically just if they look up Concept Occupational Health, you'll find us. And as I said, we are based in Banbridge, but we cover all over Northern Ireland and Ireland as well. So we're very happy to travel. And typically we do go on site to do these testing. We do have the facility to have people at our offices to do it. But when you've got a large number of employees, or even a small number of employees, typically we can do maybe 8 or so testing a day. So that's 8 employees. So it's better to go on site and do that if they have the facility to do that. So yeah.
Excellent. I noticed on your website that you have the enhanced wellbeing. Could you tell me a little bit more about your enhanced wellbeing services?
Yeah, so we know that we're living in a time where access to the likes of NHS is limited, and occupational health is in no way a replacement for the NHS. And we're not GPs, we're not there to diagnose anybody or treat anybody. However, we do have services that allow for individuals to get testing done that they may not have just because they maybe don't have the time or they can't access it. So we do these corporate health checks. They're just employee health checks. Yeah. And it doesn't have to be risk-based, as in the employee could be administrative, they could be doing different tasks, but we would go in and we would do the likes of blood pressure, and we do body composition analysis, we can do cholesterol finger prick testing, diabetic finger prick testing, and then we can give reports to the employee. It's about empowering the employee to make sure that they know basically their results and what to do with them. And that typically is a confidential service. We don't give any information back to the employer. We do give them maybe, statistics about, we've seen 14, of which 2 are going to the doctor, things like that, but we wouldn't give them actual specific information. And that is something that we offer. And there's lots of lovely employers here in Northern Ireland that do that service for their employees. And because it really does boosts morale, and it shows that the employer is really, really concerned about the employee and their health, whether that's, and we know that it leads to better outcomes for everybody, for the employee and the employer, so that would be one aspect. And the other one is we do support with mental health. In particular, stress in the workplace is quite a big concern for people, in particular in the current climate. So what we do is we do stress assessments where we would chat to the employee and we give advice both to the employee and the employer about how to manage that. And we do lots of signposting to mental health services, both private and public sector, to ensure that the employee can get the best support that they need.
So we'll come back onto stress, because it's a massive thing. Yeah. So what strategies do you have? Or do you do a service that just signposts? Do you do any strategies yourself within your own company?
So with my employees, thankfully, I have a very nice, close-knit team within ourselves. So it's easy for me to check in with everybody and make sure everybody is looked after. We offer private health insurance to our employees and ensuring that they have access to anything. And that's really easy to govern when there's just a small team of people. But whenever it's a larger team, it as in for the external and the employers that we're supporting, it's a bit more difficult. So we do give them advice in relation to that. And we're very much a local service, and we want to signpost to local services. So we have lots of lovely connections out there of services that are also private sector that we can get employees in touch with through the employer, and lots of employers will fund for employees to be able to access that, and that's a really good benefit to have as part of employment. But in my small team, it's very easy to manage, and I'm a great employer, so so
there's no stress in the workplace.
No stress at all. No, definitely not in our workplace.
Yeah. So what's your plans for the future?
So grow. Yeah, definitely. We want to be up there with the local providers and providing a really, really cost-effective, good, well-valued service, and that's what we're aiming to do at the moment. So we seem to be going the right direction towards that. So the plan is for the business to grow, to be able to support locally and be accessible. That's the big thing we want. We want people to be able to contact me directly looking for advice. We want to be able to support both employees and employers. I think there's been a misconception about occupational health for quite some time. A lot of people don't know what it is, firstly, get it confused with occupational therapists, or they think that maybe sometimes in the past, maybe occupational health was used by employers to maybe, at the end of maybe an absence management case where be the final step as such, and then it's kind of occupational health is nearly seen as, this is the bad thing to be going to.
The gatekeeper.
But, yes, the decider of all fates. So basically, it's not that we want to, the big plan for me personally is I want to grow the profile of occupational health within Northern Ireland and Ireland, make people aware of the services that we have, make people aware of the accessibility of the service and the benefit of having us in place from the very beginning. And that is what we're hoping to do. So yeah.
I think one of the biggest benefits, a happy staff, safe staff, it reduces absenteeism.
Yeah.
And as an employer, that is a big one,
Absolutely. And you want your team, you want people to come join you and stay with you. High turnover of staff is not good for anybody.
No.
So a part of that is we have to be realistic. We're living in a time at the moment where health, good and bad health is something that is very prevalent for everybody. And that obviously has been, emphasised by having had COVID and what's happened as a fallout from that. So we need to, identify as well that most of our waking hours are spent at work.
Yeah.
So we want to ensure that we are doing everything we can. I am a medical practitioner. I want to make sure that I'm supporting people and making sure that their health is prioritised within the workplace, and that, as I say, it is an arrangement of services that we offer, but it's all about empowering the employee and protecting the employer.
That's fantastic. As an employer, we want to be protected, but I also want my team to be healthy and happy, and your health is definitely your wealth.
Yeah.
You said something off camera, which was really, really good about the service that you offer, like a pre-assessment prior to employment, that gold standard.
Yeah.
Explain to the listeners what the gold standard you think in occupational health is.
So in relation to pre-employment, I definitely, it's best practice that everybody that comes on board for your company has a pre-employment questionnaire completed.
Yeah.
So we do offer that service, and we're very lucky that we have a portal that we use, that everything is done paperless, it's all done confidentially, and that is a service that we offer to lots of businesses, and they do take up on that. And then once that questionnaire is completed by the employee, then it would be the likes of myself that would go in and assess it, and we issue reports then to the employer. But sometimes we need to contact the employee to get more information, and we give advice to employers then, maybe if there's a health condition, just about things they need to be aware of, whether that be undertaking risk assessments or accommodations within the workplace, even things like an ergonomic furniture assessment if it's a musculoskeletal condition. So that would be, for me, best practice. But then also then for employees that are going to be exposed to anything deemed hazardous, is about having baseline medical done. So that would be where they would come to our offices, or we would go on site and we would do a baseline hearing and spirometry, skin assessment, things like that, depending on what they're going to be exposed to. And that is very much so, it's great for the employee to have it done, to make sure that we're identifying any issues, but also for the employer as a protection. And it's also a legal requirement to make sure, and it makes things a lot easier for us then, and we go in subsequently a year later and to do their health surveillance, that we have a baseline to say this is where they were at the very beginning of this employment, this is where they are now, and then we can do a comparison results and say, okay, what's changed here in this year, and then we can go about giving this advice to the employer and the employee about how to manage that. So that to me is best practice and gold standard, and a lot of people do follow that. You know, I've had fantastic experiences here in Northern Ireland with companies that do that from the get-go. It's unfortunately the smaller enterprises that tend to not have that facility in place, and that could be for different reasons. Maybe they just didn't know of that service, or it could be funding that may be the concern. But we just know that putting that money into an employee from the very beginning just leads to better outcomes for everybody. So, yeah.
Excellent. So you did touch there, because I mean, I know about occupational health. Obviously, I worked in the trust for years. Yeah. So that was, big companies always had occupational health, but smaller companies, it wasn't something. I'm learning new stuff today myself.
Yes.
So do you have different packages for different size companies, or is it one size fits all, or what way does it work? So what I'm asking, probably from the listener's point of view, but maybe from a business point of view as well.
Yeah. So it's very much an individual service, and that's where, so the way it would typically be is somebody would send an inquiry into us, and then they can put as little and as much detail as they wish into that, and then we follow it up, and then depending on what it is that they're requiring, it gets escalated to whoever can deal with that. So predominantly it's me, and then we would set in a quote to that individual or to that business, making them aware of the different services that, you know, may be prevalent for that area that they're working in, for that employee number, giving them a cost structure. But ultimately it's up to them about what they want to do. You know, the health surveillance element of things, it has to be a risk assessed approach. So we would hope that employers are putting that time and money into making sure that they've got health and safety coming in, and health and safety doing the risk assessments. So then it's all evidence based, and we know where we're going to go from there. It wouldn't be, you know, one size doesn't fit all, thankfully, because we wouldn't have time for that. But it has to be very much so, you know, the standard is set by what they're exposed to, and it's about ensuring we don't want to be doing too many testing, you know, irrelevant testing. We want to make sure that we're giving, as I said, a very costly service that is, you know, time efficient as well. So yeah, it has to be very much individual, and I think majority of occupational health businesses take that approach with private sectors, with small medium enterprises. We make sure that we're doing it, you know, giving them number of options in terms of services that we can offer, and ultimately leaving it for them to make the final decision with that.
I think it's a fantastic service. Excellent, well done.
Thank you.
And it's lovely to hear it's nurse led as well.
Yes.
Not that I'm biased or
No,
anything.
we're not biased here. No, definitely not.
So just to finish up, let the listeners know how they get in contact with you. Give your contact details so that they can, you'll be inundated now with inquiries.
Yeah, well, you can find me on LinkedIn. So my name is Rachel Mearns. You can find, and then Concept Occupational Health is the business. You can also contact me directly. My email address is Rachel, or SEHEL, @conceptoh.co.uk. Alternatively, you can find us online. We've got a lovely website that was designed by a local Banbridge website designer. And we also have a LinkedIn, a Facebook, and an Instagram. So you can find us everywhere. Yeah. We also have started, we're very much, as I said, a local service we want to provide to local businesses, but we also know that word of mouth and things like that, reputation is a very, very important thing. So we've started a Trustpilot, so we're trying our best to get some reviews in, good and bad, but there's not been any bad ones yet, so that people can, and it's just about getting out there and as I said, making people aware of occupational health. And there is other providers in Northern Ireland, and they're fantastic as well, like unbelievable, and they have set the standard for all of us. So if it's not ourselves you go to, please just look out for occupational health in Northern Ireland and look into your business and make sure that you're doing risk assessments and that you're looking after the health of your employees. And we're here to help if you wish to come our way. So yeah.
Thank you so much,
Thanks,
Rachel.
Emma.
Local Women Magazine presents Local Women Podcast, the show for things that matter.